This week on Real Talk with Denver7 and CPR News, inequities in maternal health care are taking a toll on women of color.
The past 5 years is the first time that I've heard from a Black pregnant person say they were scared to die.
And experts say it's no easy fix.
We know that our systems are really have racism that exists, implicit bias.
We have a real talk about maternal health for women of color, the resources available for you, and the contributing factors to Colorado's rising maternal death rate.
Welcome to Real Talk with Denver7 and CPR News. I'm Colorado Public Radio's Nathan Heffel.
And I'm Denver7's Micah Smith. Each week in a partnership between Denver7 and CPR, we'll have a real talk about issues impacting underrepresented people across Colorado.
This week, we're having a real talk about the maternal health challenges facing women of color. Studies show notable discrepancies in how women of color are treated during pregnancies and labor compared to white women.
But with rising mortality rates come more resources for Black and Latino women. I met with a group of doulas who are providing life-saving care for expectant mothers. In 2023, Colorado's maternal death rate is rising, and Black mothers are most at risk.
I've been doing midwifery work for almost 20 years, and I think the past 5 years is the first time that I've heard from a Black pregnant person say they were scared to die.
The latest statistics show Black mothers are 3 times more likely to die during birth. And CU Anschutz Director of Midwifery, Jessica Anderson, says there are several contributing factors.
We know that our systems are really have racism that exists, implicit bias. Care looks different in certain areas of our communities, meaning people don't have access.
Anderson says some of her patients are taking matters into their own hands, turning to doulas, trained professionals who help with physical and emotional needs.
My personal reason for getting a doula is to help navigate a very racist healthcare system.
Just having a doula present greatly changes how a birth outcome would be, that positive birth experience.
We visited Mama Bird, a maternity wellness spa in Aurora, where we talked to this group of doulas and new moms.
My first pregnancy was during COVID, when everybody was paranoid about everything in regards to going to the hospital. I had my doula in my first experience, so it was life-changing care.
But there are still barriers to having the support of a doula.
I think it's also partly affordability. We don't live in a society that offers universal, free, quality health care.
A lot of people don't know what a doula does. They look at it like a luxury as opposed to a necessity, and that's not what it is.
As the co-deputy director at Elephant Circle, we actually do a full wraparound, services, from legal douling to supporting birth workers.
Mama Bird also offers help.
On our nonprofit side, we have partnered with Colorado Access to provide at least 40 Black families with full spectrum doula support.
These women say for years they thought they had very little say on how they could bring their children into this world.
Ultimately, I think the part of our advocacy is teaching them how to advocate for themselves.
With the help of their doulas, they feel empowered to make some of the most important decisions of their lives. Now, before this report, Nathan, I did think that a doula was a luxury, but after this roundtable discussion, I learned that it's really not. And the way that it's helping outcomes, I mean, even just the women in that circle, hearing about their experience, you could almost see in their face the calmness that came over them when they talked about their doula and they talked about their birthing experience. And I just think it's something that every woman who wants to should be able to experience.
Yeah, and they have that support
Absolutely.
Right there. Well, we want to go more in depth with one of the organizations you heard from in that piece. We have Vida Malama from Elephant Circle with us now for this Real Talk. Vida, thanks so much for being here.
Thank you for having us.
So first, tell us a bit about what Elephant Circle does.
Yes, that is a very good question. We get that a lot, but basically Elephant Circle is a birth justice and reproductive justice organization that supports birth workers. We do policy and advocacy work, and we provide support, direct support to people in the community who need support from anything from parental rights to also actual birth support, advocacy in the area of reproductive rights. And we work with all sorts of organizations, from correctional facilities to schools where there are teen parents and pregnant parents. And we also work on the Hill. So we do quite a bit of work throughout the state.
I love that, birth justice. I've not heard that before, but how important it is to name that and to say that.
Thank you.
Yeah.
Yes.
Well, your name is inspired by elephants who give birth in a circle, or within a circle of support, that is. What does support look like for your organization? I know that you named a few just a moment ago, but let's go deeper.
So our support is modeled by elephants in the wild. So what that really means is that whenever an organization, an individual, perhaps it's even policy work, or community members are needing support, most recently, we are involved in building the ecosystem of birth centers throughout Colorado, because there are also some challenges there. So what that really means is that instead of coming in and acting as consultants and telling organizations and individuals what to do, we basically provide support in the sense of what can we do to clear that pathway, to create that watering hole that's going to allow you to have the tools and the resources that you need for your community.
And I think on the Elephant Circle website, it talks about the need to take down systems of power and oppression. What are some things we can do now to help the systemic problem, to bring people to that watering hole?
Yes, so I don't think that that's really an easy question to answer.
Right. We only have 5 seconds. Go.
Thank you for letting me do this short. So really what it is about elevating community. So really what we really like is when community comes in and they say, hey, this is a problem. You know, they're really the rumbles that we hear in the community, the vibrations that we hear. That is kind of like how we tune in to what's going on in our community. So when we take on any type of engagement, any type of force to be reckoned with, it truly is something where we allow community to come in and do that work. We're not the ones who are truly advocating for, hey, this is an elephant circle thing. It's more of a community-centered and oriented idea and perspective.
Yeah. We know there is a delay in a maternal mortality review being released by the federal government. How is that impacting your work?
It is actually impacting our work quite a bit. So the last report that was released was in 2020. And that data was collected, if I remember correctly, between 2013 and 2016. So even then, there is a lapse in the time frame for when that report was released and what was happening at that particular time in climate within the state of Colorado. Now, most recently, with the delay of the report, it's also, you know, the concerns are that, well, when is the data again being collected? How relevant is that already to what the changing climate is? So I'm going to assume that we're probably collecting data somewhere between 2016 to about 2019. So even then, there's been so much. That was pre-pandemic, for example. So it's like, well, we're certainly not in the same climate. The other piece is that it helps inform, you know, our legislative policy work in the area of them being able to make decisions based on data. So even with that lapse, it's like, well, how timely is that? Do we need to regroup or pivot in a certain type of way that's going to allow us to be more effective? And then it just kind of erodes trust in community as well. It does not really provide transparency, timely transparency, and a way for community to actually support, get involved, answer questions, or advocate, because that information is being withheld at this time.
And what do you want to say to state or federal officials that are holding this program, holding this study? What do you want to say to them?
They need to release the report. We're ready. We've been waiting. You know, it's been over a week at this point, and we don't really know how much longer that's really going to be for them to actually get that done. But the idea is that, you know, we as a community, we want to also be involved in the in the solution to the problem. We don't just want to say, well, here's the report. When the report originally came out, there was certainly some anxiety within, at least being representing as a Black woman, some of the concerns that were actually released in there about, you know, death and dying. And I would have to say by the time the report was released, I had 2 children already in 2013 and 2016. And I don't think, from my own personal experience, it was really about me having a fear of dying as much as the fact that I was not really listened to, the fact that I was not There were things that were done in the procedures that weren't done fully to the effect that affected me now. And the fact that, it's like, yes, could I die from those things? Absolutely. But it's really, there's plenty of time to rectify those situations. You're gestating for almost 10 months. That gives you plenty of time to address those issues. The issues that are happening in BIPOC communities are not necessarily substance use or drug misuse or depression as much as like cardiomyopathy, preeclampsia. Those are the things that are really plaguing our community, and there are things that could be timely intervened, could provide timely intervention so that we can address those, so that those are not the issues that we are struggling with.
Yeah, you're speaking to some important issues there, Vita. Well, we have to wrap this up, but this has been an excellent conversation. Vita Malama from Elephant Circle, thank you so much for joining us.
Thank you.
Well, we have much more to get to for this Real Talk on maternal health. Since not all women are the same, there can be big changes when it comes to race.
We dig into what can be done to help alleviate some of these problems. This is Real Talk with Denver7 and CPR News.
Welcome back to Real Talk with Denver7 and CPR News. I'm Denver7's Micah Smith.
And I'm CPR's Nathan Heffel. Today we're having a real talk about the maternal health concerns for women of color. Back in April, CU Boulder released a study looking at the impacts of obstetric racism in the U.S.
Per the study, obstetric racism is the term coined to describe a concerning pattern of maltreatment of non-white pregnant women, including a disregard for their birthing wishes. There are a number of factors that contribute to this, one of them being the increase in medical induction of labor. Between 1990 and 2017, induced labor nearly tripled across the U.S.
Yeah, researchers say early induction can lead to low birth weight babies and a number of different problems later in life. Here's the thing. Researchers say white women are being induced more because they're seeing an increase in higher risk pregnancies. The same cannot be said for Black and Latino women, yet decisions about their care are still being based on trends in the white community.
Yeah, we want to provide you with more context here. We have Jessica Anderson with us now. Jessica is the Director of Midwifery Services for CU Anschutz. Jessica, thank you so much for being with us.
Thank you.
You just heard about the CU study. You heard some of those statistics. What inequities are you seeing when it comes to maternal health care for women of color?
Yeah, I mean, I think that it's multifactorial, unfortunately, right, which makes it hard to tackle. But I think from systems to providers, there are care can look different, right, because of implicit bias, because of the racism. Access to care looks different, or access to different or similar types of models can look different. So I think it's multifactorial, which makes it hard, right, hard to tackle.
And midwifery is seen as a more traditional way of birth, and some people may even see it as a luxury. How has that changed, though? How has that thought process changed? It's becoming more modernized, I think.
Yeah, well, hopefully, yeah. We think we should be catching more babies in the United States, right? We're really experts in labor and birth, and our goal as a profession is to really provide access to all people to have access to a nurse midwife and the space that they want to give birth in.
And so is it asking the right questions when someone who is using your services, is it being the person in the room saying, hey, that doesn't seem quite right? Kind of go a little bit deeper into that.
Yeah, I mean, I think it's having the discussion with people prenatally, right? Like, what are you expecting? What are you envisioning for your experience? What can we offer you? Because there are certain conditions that care needs to look different, right? And so what are you envisioning? What are you wanting? That discussion needs to happen prenatally, not in the moment when we're giving birth.
Got it.
Yeah. How open are women of color, communities of color, to these services?
Yeah, I think people are open, but I think it's the access, right? I think when you are in urban metro areas, access looks different as you start to leave those urban areas. And for us at the CU College of Nursing, our goal and our mission is to serve Colorado communities. And so we're really aiming to take nurse midwifery to those communities that lack access.
And how do we improve that access?
Yeah, we need more midwives. We need more nurse midwives. And so our goal is to provide the opportunity for people to have access to nurse midwifery education, and people of color to have access to nurse midwifery education, right? We need to diversify our workforce, and that's one of our goals roles for our profession as well.
Is it a long process to become a midwife? And how does that work?
Yeah, so it's a master's, so you need a master's to be a nurse midwife, and so it's a challenge, right? It's a lengthy process, so 4 or 6 years, depending on the route of how people get there, and it takes a lot of time and effort. And the one thing that we're really focused on in the state and in our program is really making it a virtual option, right? So people can be in their communities, and especially if it's a rural community, and still accessing our program. So they have to come to campus, right, to provide care because we need people, but to take the coursework, we're really trying to make that virtual option more accessible.
Someone who's not a parent, I hope to be one day. When I hear the words midwife, when I hear doula, some of it starts to blend together. Can you differentiate for us those two terms?
Yeah, so different roles, right? Different responsibilities. And to me, the perfect setting is when we have a provider. So if it's a midwife, it's a physician, and a doula and a nurse all joining on the same team in the hospital setting, right? Because we all have a different goal. We are all able to provide that support to the patient in a different way. And so while we are, as midwives, sometimes focusing on the medical piece of labor and birth, the doula can really support that emotional, that mental, that physical support, which we're not always the best at. We can do it, but really it's a complementary kind of a team approach that we need to happen.
And we've talked about systemic racism. How do you start to dismantle it in this framework? It's a big question. Is it schooling? Is it hospitals? How does that work, and how do we begin to tackle that?
It's all of it, right? So I think it's from our education programs, it's to the systems we work in, it's to the individual doing their own work, it's to the policy and guideline. It's really taking a step back and saying we need to look at every inch of what we do to start dismantling that racism and start creating environments that are really welcoming for people of color to give birth.
Well, Jessica, thank you so much for joining us for this Real Talk. We know that these systems of oppression can really take a toll on women of color, but there are people out there ready to help you through the mental challenges. I sit down with a psychologist who's focusing on the intersection of maternal mental health and the experiences of women of color. This is Real Talk with Denver7 and CPR News. This is Real Talk with Denver7 and CPR News. I'm Denver7's Micah Smith.
And I'm CPR's Nathan Heffel. This week we've been having a real talk on the maternal health for women of color.
I sat down with a clinical psychologist and maternal wellness consultant to discuss how these women can take care of their mental health amid these struggles. Patrice, we've talked a lot about the maternal death rate for Black women, for moms of color. That has to have an impact on a mother's or a mom's-to-be's mental health. What are you seeing in your professional experience?
Sure. I think that when we talk about the maternal morbidity and mortality crisis among Black women and birthers, usually we're talking about physical health conditions. And there's not always a mention of mental health and substance misuse as well. And what we know from the research and just sort of even from data here in Colorado is that women of color, including Black women, are 1 in 3 is the prevalence of perinatal mental health. And then substance use, we just haven't studied it as much, so we don't know. But we would assume that the same inequities that exist around physical health exist around substance misuse, and they certainly do around perinatal mental health. So this is a tremendous crisis for our community. And then in addition to having very high prevalence rates, right? So it's occurring even higher than it does in the general population. And this is the most common complication of pregnancy in the postpartum period is postpartum depression. So if it's occurring among women of color at a rate of 1 in 3, then we have all of these women in our community that are needing resources and access to services. And we do know that we don't have the provider community, and we don't have just sort of all the resources that we need to support women.
Yeah, for those women who really want to be mothers, they look forward to that process, but they are seriously afraid. They have a lot of anxiety, maybe even some depression surrounding how they might be treated by the medical community.
Yes.
What can they do?
Sure, sure. So I know that it's become a big fad, I think, in the past few years to have Black women advocating in medical settings. And I sort of move away from that as a strategy, just because you're in no position to be an advocate for yourself when you're giving birth. So what I would say is to build up a strong network of support people around you and arm them with the resources and knowledge that they need to support you and to execute what you would like to happen in your birth. I would also say in Colorado there's a lot of great organizations that are working on this issue, and so there's policy work happening, there's work happening at the hospital or systems level, and certainly I am someone that would love to be a connector if folks are like, I'd like to engage after my birth to make it better for others going forward. So that's probably my number one recommendation to women is make sure that you have those support people around you and make sure that they know what your wishes are and they understand what you want for your birth. And then if something does occur during that process, reach out to those of us that work in this policy and hospital space and let us know what's going on so that we can also let the higher ups and the systems that be know what's happening, because the onus is really on them to make birth a safe and equitable place for Black women.
In this show, we talk about doulas, midwifery.
Yes.
Are you seeing maybe some of your clients turn to doulas and midwives maybe to offset some of that mental anguish that they're going through?
Absolutely. So we know that for Black women in the Black community, doula care and midwifery care is rooted in history. These are the folks that delivered our ancestors' babies for generations. And so when I talked about putting that support community together, a lot of times I'll recommend to folks to get a doula or a midwife if that's something that's of interest as a part of that care team. And I think it's just so important for women to know what their options are around birth, right? So a hospital birth is one option, but there certainly are other settings where safe, equitable birth is occurring. And so I do think it's also on us and as the providers to let Black women know what their choices are.
Another issue I found, just even in my personal life, talking to my sister, my friends, people I'm close to, a lot of people have a lot of opinions about how you should give birth, who should be helping you give birth, where you should give birth. Any advice on trying to focus on what is best for you and your baby?
Yes, absolutely. So I would say to explore all the options that are available to you. So explore midwifery care if it's appropriate for you, explore doula care, explore hospital-based care, and even if you get a physician provider that you're like, I'm not crazy about this doctor, you can have another doctor. So if you're getting care from a provider that you're just like, I'm not feeling this person, certainly you can jump to another provider. So I would say understand and be educated about what all your options are, and then let the people that are important to you in your life help you carry those out.
Patrice, how can our viewers and listeners get a hold of you and learn more about this?
Yes, so there's a couple ways. So I'm the program director for the Birth Squad Denver, a program of Colorado Postpartum Support International. So we do have a website and a web page where my information is available. And then I'm Patrice at thebirthsquad.org.
Thank you so much, Patrice.
Thank you.
And that's this week's episode of Real Talk with Denver7 and CPR News. Every week, we'll be having a real talk on issues that impact Coloradans who are often overlooked.
Yeah, and you can find all of our shows on denver7.com/realtalk or at cpr.org/realtalk. Have a great day.